Great. Thank you again, Amy. Well, as most of you know who've been attending council meetings, that due to the critical need to strengthen our public health workforce, this agenda item has been a standing item for the past few years. Today, we are fortunate to have with us Andrea Young, who's the director of the Division of Workforce Development in CDC's Public Health Infrastructure Center. And Andrea will be talking with us about the important work of this division in addressing public health agency workforce development needs, as well as other needs of the overall public health workforce. I've had the pleasure of working with, I guess I should say, Dr. Young. Sorry, Andrea. I've had the pleasure of working with Dr. Young for more than 20 years. In the early years of the core competencies for public health professionals, that was probably some of the initial work, and Julie, you reminded me of that as well, that Andrea helped us refine that initial set and advocated for the competencies within CDC. At that point in time, there really wasn't a lot of thought within CDC about whether or not there should even be core public health competencies and how those would be used. And Andrea was a big advocate for that. In addition, she played a major role in helping public health practitioners have greater access to use of evidence. She served as Associate Director of Science and Branch Chief for the Applied Systems Research and Evaluation area within the Center for State, Tribal, Local, and Territorial Support. Everybody remember CSTILTS, preceded by OSTILTS, preceded by FIPO. Oh my God, I'm old. Andrea was there, really carrying that torch about the use of evidence. She also co-chaired with the National Library of Medicine the Partners in Information Access for Public Health Workforce Initiative, or affectionately referred to as PH Partners. So without further ado, Andrea, let me turn it over to you, because I'm sure people would much rather hear from you than me. So Andrea.
Thanks, Ron. That was a really nice introduction. We have known each other for a long time, haven't we? So I'm pleased to be here today. I'm so thankful for Ron for inviting me to talk about the Division of Workforce Development's efforts to strengthen the public health workforce. Next slide. So just a little bit more about me. I'm relatively new to the role of the director for the Division of Workforce Development. I've been in the position now for about 8 months. I'm going to take a minute before we jump into our priorities and programs and what we've got going on in the division to just quickly kind of orient you to the organization of the division. So along the bottom of the org chart, you can see we have 4 branches. Some of these faces might look familiar to you. Moving left to right, we have the Education and Training Services branch led by Gabby Benenson. This is the organization that manages CDC training collaboration with Public Health Foundation and offers 11 different types of accredited continuing education credit and a variety of other services too, which I'll touch on a little bit more later in the presentation. Next, we have the Epidemiology and Laboratory Workforce branch. This is the home of the Epidemic Intelligence Service, EIS, program, among other fellowships. I'm sure some of you are aware of that. And then after that, we have the Field Services Workforce branch, which is best known for the Public Health Associate Program, PHAP, again, one of our larger flagship fellowship programs. And then finally, we have the Public Health Workforce branch, which manages 5 different additional fellowship programs. They're a little bit smaller than EIS and PHAP, and they focus on a little bit more analytical, purely analytical, like data science, modeling. And so I'll talk a little bit about each of the fellowships as we proceed. Next slide. Here we have the division's 4 strategic focus areas. Goal area number 1 is focused on quality learning, something important to all of us. It's focused on strengthening the skills of the current workforce through quality accredited competency-based training and building a diverse public health workforce through applied fellowship programs. Our second area of focus, valuable service, is all about the services that our fellows provide at their host organizations and their participation in CDC response to domestic and international public health emergencies and needs. So some of you might be familiar, if you worked in health departments, of requesting a CDC epi aid or lab aid. It's a team that comes in and provides technical assistance to the jurisdiction experiencing a need. With goal 3, national leadership, we're focused on facilitating the use of standards and best practices for training and workforce development programs, building the evidence to address identified needs and inform practice, and fostering results-based partnerships like one here today. And then finally, our fourth goal, it's internal. This is an internal facing goal focused on the division's own foundational capabilities. We have to have a strong foundational capabilities within our division to deliver the programs and services of the division. So we are focused here on making sure that we have physical accountability, management operations, communications, evaluation, those kinds of cross-cutting foundational activities. Next slide. So the division directly manages 10 different fellowship programs. Programs range from opportunities for middle and high school STEM teachers to service learning career fellowships available to individuals at the bachelor's degree level and graduate level. And these fellowships cover a broad range of cross-cutting skills and competencies, including epidemiology, evaluation, informatics, modeling, general public health practice, laboratory leadership skills, among others. In FY23, we had over 730 active fellows participating across these 10 fellowship programs. And now, though, without the COVID funding, our fellowship classes are getting smaller. So we still have some of our COVID-funded fellows still active, but they'll be rolling off throughout this year. So our class sizes will be getting smaller with the reduced funding available. For example, the PHAP class of 2022, which graduates in October, at the start of that class, it was nearly 150 individuals. The new PHAP class, which is starting in October, includes 46. So you can see we've had quite a reduction in the size. At the moment, we do not expect to increase or be able to increase the number of fellowship graduates entering our programs and then ultimately finding pathways to governmental, state, tribal, local, and territorial public health. Rather, right now we are focused on continuously improving the effectiveness of these existing pathway programs, using our evaluation results, and really working hard to ready fellows for employment in the public health system upon program completion. So for us, retention of these fellowship graduates in public health after they complete the program, getting them into public health and staying there is a big priority for us. Next slide. So equally important to recruiting and developing the next generation of public health workers through our fellowships programs is training and developing the current public health workforce. And thanks, I mentioned this before, thanks to our collaboration with Public Health Foundation, we're able to connect partners and health professionals with accredited competency-based training from CDC, other federal agencies, and federally funded partners via CDC Train. And as I think you all know, CDC is part of the Train Network, a shared learning management system available across the country. The state, tribal, local, and territorial public health agency staff, healthcare providers, academia, and K-12 education providers. As part of the network, CDC courses reach nearly 4.9 million learners who use the broader Train network to take public health trainings. This is a really important system and vehicle for us to get out competency-based training and accreditation, and appreciate the collaboration with Public Health Foundation. Next slide. So CDC Learning Connection, it's a free training promotion service that we offer to CDC programs and partner organizations. This service promotes quality trainings through a website, a newsletter with over, I think, 676,000 subscribers, social media, and other partner outreach. The CDC Learning Connection newsletter, just so you know, has the highest number of recipients among all the CDC newsletters. So it's very popular and active and has a big audience. Also, the website makes it easy for learners to get to CDC train, define training, and get CE. And in FY23, we're still counting our FY24 stats. So I'm referring to our FY23 right now, but our FY23 CDC Learning Connection featured 33 trainings and promoted 77 additional workforce-related resources. Next slide. So our partnership with Public Health Foundation on CDC Train and other activities is a great example of how the division collaborates with partners, depends on partner organizations to serve and support the public health workforce. So here on this slide, I'm just highlighting some of our key partnerships. The CSTE Applied Epidemiology Fellowship and the Applied Public Health Informatics Fellowship. These are two programs that serve as pathways to careers in public health. The fellows are placed in state and local health departments for 2-year fellowships where they receive on-the-job training and development while serving the needs of their host organizations, which are typically health departments. And we also fund CSTE's Data Science Team Training, DSTT. This program is focused on the flip side of the coin, the upskilling of current health department staff. These data science team training teams receive just-in-time training and technical assistance tailored to their needs as they tackle real-world data science projects. So they work a real project as a team that's relevant to their organization, and then they receive technical assistance and training to help them upskill and be able to tackle the project. Our partnership with ASPPH, I'm still on this, thank you, allows us to place fellows in service learning assignments within CDC centers, institutes, and offices. And then finally, at the federal level, just wanted to highlight 2 federal partnerships. We collaborate with AmeriCorps to establish the Public Health AmeriCorps program, which is now in its 3rd year. And then we also collaborate with HRSA on the Public Health Workforce Research Center, which I will dive into now a little deeper on the next slide. So as Ron mentioned, I previously had a number of science-related positions, so this particular project is warm to my heart. Our partnership with HRSA is important to our evidence-building efforts. HRSA and CDC have co-funded University of Minnesota, which includes a consortium of academic member institutes and practice-oriented partner organizations via a 5-year cooperative agreement. We refer to this as the Public Health Workforce Research Center. This cooperative agreement was first awarded in 2022. It focuses on 4 national level priorities that you see here on the slide, evaluating the role of various occupations in delivering programs, investigating the composition and size, need, and distribution of the public health workforce, assessing various workforce development methods that are focusing on like recruitment and training models, and then studying implementation of various workforce strategies and interventions. And through the Public Health Workforce Research Center, we support efforts to define and build the evidence to address public health workforce needs and guide practice. Years 1 and 2 research projects have yielded 9 peer-reviewed publications and 16 presentations at national conferences to date, and that's constantly ticking up. With the release of the Public Health Services and Systems Research Agenda earlier this year, we were able to use the domain devoted to workforce to help us align the PHWRC, or Public Health Workforce Research Center, with the national evidence building effort. So approximately 75% of the new projects for this cooperative agreement, there are 10, will advance the public health systems and services research agenda. So we're trying to align nicely with that particular agenda moving forward. And that's all I have. That's it.
Great. Well, I welcome people to ask questions.